And welcome back to Navigating Cancer. And we've been talking about colon cancer, anal cancer, colonoscopies, just overall how to take care of ourselves. And you had, recent experiences and have been very successful. What are some of the main tips that we could give to the people at home that?
Well, one thing that I did after I got diagnosed is, and this was from an encouragement of a very good friend, she said, go online and find yourself a support group. Well, you think it's going to be people just posting their experiences, but actually you get a lot of support and a lot of very good tips on what works and what doesn't work in your specific disease. The one that I found most helpful was Blog for a Cure, www.blogforacure.com. And you just go and there's you register with whatever your type of cancer is, and then you're in that sort of
that room.
Not really a chat. It's a room, yeah. And then it's like Facebook. You sign up to be, you see somebody and you become their supporter, and then you all sort of chat back and forth. And so anytime I had a question, because trust me, I had a lot of questions in the beginning, and so I would put it on there, and you always got multiple answers back, usually in the same day.
Which is
fabulous.
Good, rather than just one person's opinion about something.
Another thing I did is this is a repurposed binder that I
that's a big one.
had from an old job, but I decided that I needed something to keep all of my paperwork together. I think this is good for anyone with any kind of chronic illness.
That's right.
Or cancer. It's you just need to be very organized. I took this to every doctor's appointment and every radiation appointment, because you never know. In it, I've got all of the phone numbers for the pharmacies, just in case. And I also had a spiral notebook. This I wrote every appointment, and in advance of an appointment, I would write my questions for the doctor.
Oh, super.
Because they pop in your head, and you go, oh, I have to ask him this. And so I kept this in my kitchen, and I was just, I'd jot in it, all the time. So I also went and printed out a calendar for a weekly calendar, and every day I record how much water I drank, what I ate, how I felt, how much I weighed. I weighed myself every morning before I did anything. And like I said, I lost 17 pounds, which actually made me very happy. So that's a plus.
Bad way to do it, but...
Well, yeah, bad, but in retrospect, it's
done now. That was one of the positives, right?
Absolutely. It's all done now, so I'm very happy about that. And then I had a tab for research, and then the doctors would give you information, and the nurses, and so you just want to keep it all together. And it's very helpful when you look back and you go, oh, this week, and I've also got it marked by weeks. And so it's helpful when you go back on the blog later to help the people that now have newly diagnosed anal cancer. And you can pretty much say, well, when you get to week so-and-so, this is what you can expect. And this is what I did to counteract it. There are, for anyone who's going to have radiation, I think it's very important to prepare your skin in advance. And so I was advised to, by Dr. Bennett, to use lotion liberally, moisturizer, 3 times a day, minimal. But then you may have to make sure you wash it off before the radiation itself. Otherwise, it works like baby oil on the beach, and it can burn. So, and the easiest way I did that is I got in the tub every day before my radiation.
Good for
and
you.
I was in there 30 to 45 minutes. And I just took that time.
That's your spa time, right?
It was. I took that time to lay back and rest and reflect, and I prayed for the other cancer patients, and it was very soothing. And then you just get out and put your clothes on and go. So the different creams and so on you can get for the radiation, very, very helpful. And usually your medical provider will have some suggestions. I did make a 4-page sheet of instructions, things that I picked out, that I found to be useful.
Right, we have that at our office for future people, so that was very kind of her. Matter of fact, she was saying, could this be of any use to you? And I said, wow, we need to have you on the TV show. So that's how we got her roped in.
And a lot of the tips I got from Blog for a Cure. Some of them are nurse tips that, you know, I just knew what to do. And then some of them were creative inventions of mine.
So I've got to ask you a question. I guess we're running out of time, but we started out by, you said, of course, everybody's scared to death when they get some type of, you know, can't think of the word, diagnosis like this.
Right.
When did you stop being so scared?
Oh, I think I was scared all along. Of course, I have a wonderful husband who insisted on driving me everywhere and taking care of me.
Yes.
And that was really...
Support makes all the difference.
It does. Absolutely, it does. And you and I will never let an anal cancer patient be alone, so they can contact me anytime through you. I'm perfectly happy to advise them, because I did very well, and I want everybody else to do just as well.
Yeah.
Which is not to say it wasn't difficult. It was, but...
But it's sometimes you might need somebody that's gone through it that can help pull you, to just give you just a little bit more to help you make it through till we can be like you again, you know?
You know, cancer patients, I think, are like soldiers going into battle. You don't think about, you just do it.
Yeah.
And then, so you don't have time to be scared, really. That's why it's important to get started with your treatment. And then once you get started, it becomes a routine, and you just do it.
Yeah, you're accomplishing everything that you need to.
Right.
And I love the book and everything because of the fact that you're taking control. You know, we have all these healthcare professionals that we're taking their advice, but you're taking control and you're keeping yourself organized, and you know, because of that blog, maybe for some people that aren't a nurse, they would know questions to ask that, you know, so I'm glad that you mentioned that. It's www.blogforacure.com. So I can't thank you enough, and maybe we can do this again. You know, it's just very gracious of you to share your story and your tips, and thank you for also offering, because we will be in touch with other people, because people don't realize that anal cancer is prevalent, more prevalent than what people think. So
yeah, it's supposedly a rare cancer. I think they're anticipating 7,000 cases this year. But we hear a lot about it here.
We do. We treat them every day in our office. So I want to thank you, Gail Kostelnick, and we want to thank you for joining us, and hope that you'll be watching us next week for another edition of Navigating Cancer.